All right, so you guys wanted to know more about certified nursing assistants, specifically in California. And we're in luck because someone sent us a whole training curriculum. Now, you might think CNA work is all about bedpans and, taking temperatures. But trust me, it's way more interesting than that. It gets into laws
Right.
and ethics and responsibilities. And it's actually a really crucial role in healthcare.
Yeah, this isn't just for people who want to become CNAs. If you've ever been a patient yourself, or if you've had a loved one in a care facility, or even if you just want to understand how the whole healthcare system works, this deep dive is for you. It's really about showing you how things work in healthcare and giving you the knowledge you need to advocate for yourself and the people you care about.
For sure. So, to start things off, we have to talk about the laws that are behind all of this. The curriculum mentions things like Title 22 and OBRA. That's the Omnibus Budget Reconciliation Act from way back in 1987. So, what are those all about?
Well, those are kind of the big ones, the regulations that set the standard for good care here in California. Every single facility has to follow them. That's how the state makes sure they're licensed and that they're providing proper care. And even that, they're running their training programs the right way.
So, it's kind of like the rule book that everybody's got to follow. But what happens if a facility doesn't? I mean, is it just like a slap on the wrist or something?
Nope, not at all.
Huh?
They can get hit with some serious consequences. I'm talking about big fines. They could even lose their license to train CNAs or even get shut down completely. In fact, just a few years ago, there was this case where this facility kept failing to meet staffing requirements. It was outlined in Title 22, and the state ended up taking away their license and forcing them to close. And that was a huge deal. It caused a lot of problems for the residents and their families, but it just goes to show you how seriously California takes those rules.
Wow, that's a powerful example. It really makes you think. It's not just some abstract thing. These laws have real consequences. It makes you realize how important it is to choose the right facility, one that is actually committed to doing things the right way.
I totally agree. And speaking of commitment, let's talk about what it takes to actually become a CNA in California,
Yeah.
because the curriculum makes it clear that it's no walk in the park.
Yeah, for sure. It's not just a quick weekend course, it's 60 hours of learning the theory. And that includes stuff on Alzheimer's and elder abuse. Then there's 100 hours of clinicals. And on top of all that, you've got to pass a state exam, which, by the way, includes a written part A and D, a skills demonstration.
And all of that is very intentional. It's designed to make sure that people who aren't really serious about this don't make it through. To think about it, we're entrusting CNAs to take care of the most vulnerable people among us. So it's absolutely essential to make sure they have what it takes, the knowledge, the skills, and the right kind of heart to do the job well.
That makes perfect sense. One thing that stood out to me in the curriculum, it says that students who work in facilities while they're training, they have to be paid. What's the logic behind that?
That's a really great question. It's not just about being fair. It's really a strategic move to try to attract good people
Mm.
and to keep them coming back. By paying them while they train, California is basically acknowledging that hands-on experience is super valuable and that those students' time and effort are important, even while they're still learning.
It's kind of like an apprenticeship model. You're learning on the job and getting paid for it. It seems like a pretty smart way to build a workforce, especially in a field where it seems like they're always short-staffed.
I agree. It really reinforces the idea that being a CNA isn't just any job. It's a real profession that requires proper training
Hmm.
and dedication and, a real desire to care for others. But, we should probably address the elephant in the room. That idea that CNAs are just there for the dirty work, the bedpans and giving baths.
Yeah. The curriculum definitely makes it clear that it's so much more than that. Obviously, they do help with those things, the activities of daily living. But it's really about being the eyes and ears for the nurses. They're always watching
Yeah,
and noticing any changes in a patient and letting the nurse know.
exactly. Imagine a CNA who sees a resident who seems a lot more confused than usual. They tell the nurse about it,
Hmm.
and it turns out to be a sign of a UTI, which, can get really serious if it's not treated. That CNA might have just prevented a real medical crisis.
So it's not just about assisting. They're more like frontline detectives looking for clues that something bigger might be going on. And understanding that helps you, as a patient or a family member, see CNAs as real partners in care.
For sure. And the curriculum goes even further. It really emphasizes the personal qualities that make a good CNA. It's not just about technical skills. It's about having empathy, being
Mhm.
flexible, being sensitive to different cultures,
Mhm.
and being a team player.
It seems like they're trying to build a well-rounded approach to caregiving. They understand that it's not just about checking things off a list, it's about connecting with people as human beings.
That's right. And you know what surprised me? The curriculum even includes training on how to maintain a professional appearance. Now, that might seem a little superficial, but studies have shown that patients actually feel better about the care they're getting when the people taking care of them look professional.
That's really interesting. It's like saying that everything matters,
Right.
even how you dress. It all contributes to whether people feel like they're getting good quality care.
Exactly. It's a reflection of this movement in healthcare toward patient-centered care, where making the patient feel good emotionally is just as important as taking care of their physical needs. It's about creating a space where patients feel respected and heard, and like people are really there for them.
This is already so much more than I thought it would be. And we're just getting started. We'll be back to keep going with our deep dive into the world of CNAs. We'll be talking about the ethical challenges they face, the importance of keeping things confidential, and how it all connects back to you.
It's going to be good.
Welcome back. So we're really getting deep into this California CNA training. And it's fascinating how the curriculum just jumps right into the heavy stuff. It's not just about teaching them skills, it's about preparing them for some real-world ethical dilemmas, the kind of things they'll probably face every day.
That's a really important point, like we talked about before, that mandated reporting thing. It's not just a suggestion, it's like a law here in California. CNAs have to report anything that looks like abuse or neglect, no matter how awkward it might be.
So it's not just physical abuse then, right? What else is included in that?
It covers a pretty wide range. Emotional abuse, verbal abuse, even neglect. Like if someone isn't getting enough food or water, or they're not being kept clean. If a CNA sees or even just suspects any of that, they're legally required to report it.
Wow, that's a lot of responsibility. But I guess it makes sense when you think about it. They're the ones who are with patients the most, so they're going to see things that other people might miss.
Exactly. They're like the front line. They're the ones noticing if someone's behavior changes, or if there are these little signs of distress. Let's say a resident starts acting withdrawn, and they won't eat, and they flinch every time a certain staff member comes near. A good CNA will see those red flags, and they'll know they have to report it.
So it's not about being a tattletale or anything. It's about protecting people who might not be able to protect themselves. The curriculum is making it clear that CNAs are advocates, not just assistants.
That's exactly it. And if they don't report something, it's not just a question of ethics. It can actually have legal consequences for the CNA and for the facility. The state is really serious about this stuff, and they should be.
So shifting gears a bit, the curriculum also gets into the whole scope of practice for CNAs, what they can do, and maybe even more importantly, what they're not allowed to do.
Yeah, it's all about boundaries, making sure the patients are safe. By following these clear guidelines and regulations, knowing what you can't do is just as important as knowing what you can do.
So what kind of things are CNAs allowed to do?
Think of it as the basics of taking care of someone, the everyday things that a lot of us take for granted. Helping them bathe, get dressed, eat, go to the bathroom. They're also trained to take vital signs and tell the nurses what they see, and do some basic care stuff under the supervision of a nurse or a doctor.
But there's a line, right? What are some things that CNAs absolutely cannot do?
Well, they can't give medications, even over-the-counter stuff. They can't do any invasive procedures, like putting in catheters or giving shots.
And they're not qualified to give medical advice or diagnose anything. That's all for the doctors and nurses.
So it's all about knowing what they're good at, but also respecting the limits of what they're supposed to do. And knowing those boundaries ultimately keeps everyone safe.
That's a good way to put it. And here's something that people don't always realize. The exact things a CNA can do might be a little different depending on the facility. Each place has its own rules.
So it's not the same everywhere. That makes it even more important for CNAs to know the rules of where they work. And if they're not sure about something, they should always double-check with the nurse who's supervising them.
Definitely. And building on that idea of clear communication, we should talk about how the curriculum stresses professionalism. And it's not just about wearing a uniform.
Right. It's about embodying these values and behaviors
Yeah.
that show respect for the patients and your coworkers
Yeah.
and the whole profession. Think of it this way. Professionalism creates trust. It starts with how you look, making sure you're clean and dressed appropriately, following the rules about tattoos and piercings and stuff like that. It might seem kind of minor, but studies show that patients feel more confident in their care if the people taking care of them look professional.
Yeah, that makes sense. If you look and act the part, people are more likely to trust you and feel comfortable around you.
Exactly. But professionalism goes beyond how you look. It's also about your communication skills, working well with others, and of course, acting ethically.
The curriculum really emphasizes the importance of communicating clearly and respectfully, and not just with patients, but with their families and with your coworkers too. It's about recognizing that CNAs are a vital part of the team, and how well they communicate can make or break the whole team.
Absolutely. And
Hmm.
it's not just what you say, it's how you say it. Active listening, empathy, being sensitive to different cultures. Those are all essential skills for CNA. You need to really listen to your patients, understand what they're worried about, and adapt how you communicate to fit each person.
So, for instance, you might talk to someone with dementia differently, or someone who speaks a different language. You have to realize that communication is a two-way street, and building a good relationship with your patients is super important.
Exactly. And we can't forget about nonverbal communication, body language, facial expressions, your tone of voice. All those little things can say a lot. They can make people feel warm and understood, or they can make you seem impatient or like you don't care.
It's about being aware of how you come across, making sure your body language matches what you're saying.
Right?
Like you're saying, I see you, I hear you, I'm here for you.
Now, we should get into another important part of CNA training, working as part of a team. Remember, CNAs almost never work alone. They're part of a bigger team with nurses and
Yeah.
doctors and therapists and tons of other healthcare professionals.
And the whole system only works if everyone can work together well, right?
Exactly. The curriculum is big on collaboration, open communication, and mutual respect between team members. CNAs need to be able to clearly tell the nurses and other providers what they're seeing and what they're concerned about, and at the same time, they have to be open to feedback and instructions.
It's about everyone recognizing that they play an important role,
Yes.
from the surgeon to the person who cleans the floors.
Well,
And when the team works well, that's what gets the best results for the patients.
and we shouldn't forget about the ethical side of teamwork. Having your coworkers' backs, speaking up if you see something wrong, pushing for the best way to do things, those are all part of acting ethically as part of a team.
Which leads us to a really important topic that runs through this whole curriculum, ethical conduct. It's not just about following the rules, it's about having a moral compass that guides your actions, especially in a field like healthcare, where things can be so sensitive.
Absolutely. The curriculum lays out these core ethical principles for CNAs, things like respecting autonomy, beneficence, non-maleficence, and justice. These principles basically give them a framework for making tough decisions.
Can you explain what those terms mean? They sound a bit academic.
Sure, respecting autonomy means honoring the patient's right to make their own choices about their care, even if those choices don't make sense, or if they go against what the doctor recommends.
So it's about giving patients the power to be involved in their own healthcare.
Exactly. Beneficence is about always acting in the patient's best interest, always trying to do what will help them the most, both physically and emotionally.
And non-maleficence is kind of the opposite of that, right? It's about not doing anything to hurt them.
Exactly. And then there's justice. That's about making sure that all patients are treated fairly and equally, no matter who they are, what they believe, or what their situation is.
Those principles sound pretty straightforward, but I imagine things can get pretty complicated in real life.
Oh, for sure. Imagine a patient who refuses a treatment, but the CNA thinks the treatment is really important. The CNA has to find a balance between respecting the patient's choice and doing what they think is best for the patient. It's not always an easy call.
And those are the kinds of ethical dilemmas that this curriculum is trying to prepare them for. It's not about knowing all the answers. It's about helping them develop those critical thinking skills and that ethical awareness so they can make the best decisions in tough situations.
And that's where the human side of things comes in. It's not just about following rules. It's about understanding each individual patient, their values, what they're afraid of, what they're hoping for. It's about recognizing that every interaction is a chance to treat them with dignity and to fight for what they need.
This is really making me realize how much goes into being a CNA. It's not just about skills and techniques, it's about this whole web of human interactions
Right.
and ethical considerations
Yeah.
and legal requirements.
You got it. And we can't forget about the emotional side of this work. CNAs are constantly dealing with suffering and loss, and the challenges of taking care of vulnerable people. It's a demanding job, physically and emotionally.
That's why the curriculum spends so much time on self-care, managing stress, and knowing when to ask for help.
It's about realizing that you can't give what you don't have. CNAs can only give compassionate care to others if they're taking care of themselves, too.
Burnout is a big problem in healthcare, and this curriculum is smart to address it right from the start. It's giving CNAs the tools and knowledge they need to take care of their own well-being.
And that brings us to something really important that I think gets overlooked a lot. The curriculum makes it clear that good care isn't just about medical procedures and stuff like that. It's about human connection, empathy, compassion.
That's such a powerful idea. It's about seeing the person behind the illness, recognizing that they're human, and treating them with dignity and respect, no matter what.
And CNAs are often seen as the ones providing the most basic care. But they're actually at the heart of this human-centered approach to healthcare. They are the ones spending the most time with patients, building relationships, providing comfort, and fighting for their needs.
In a world that's becoming more and more focused on technology and efficiency, it's easy to forget about that human element. But this curriculum reminds us that compassion, empathy, and genuine human connection, those are essential parts of truly good care.
As we're wrapping up this part of our deep dive, I want you to think about this, the curriculum we've been talking about. It highlights something fundamental about healthcare. It's not just about tasks and techniques. It's about human connection. It's about recognizing that every person has inherent dignity and worth, no matter how old they are, what condition they have, or what their situation is.
That's a really powerful message, and I think it goes beyond healthcare. It reminds us that we're all connected, and what we do, even the little things, can affect the people around us.
We'll be back soon to finish up this deep dive into the world of CNAs. We'll be exploring how this training curriculum ultimately affects not just individuals, but the whole healthcare system.
We're back, and this is the last part of our deep dive into the world of California CNAs. This training curriculum has been really eye-opening, but before we finish up, I'm curious about the bigger picture. Like, what are the long-term effects of all this? How does it all connect back to us, the people listening?
That's the million-dollar question. I hope this whole deep dive has shown you that CNAs are so much more than just assistants. They're trained professionals with a really unique set of skills, and they have a huge impact on their patients' lives and on the healthcare system in general.
We've seen how they're advocates for their patients, how they notice things and report important information, how they handle these ethical dilemmas that most of us would have no idea how to deal with.
And here's something to think about. As our population keeps getting older, the need for CNAs is only going to grow. We're going to need more and more people to provide long-term care. And CNAs are the foundation of that whole system. So this curriculum isn't just about training individuals. It's about creating a workforce that can handle the challenges that are coming our way.
And that brings up some important issues, doesn't it? Like how much they get paid, what their working conditions are like, and how much we value this profession as a society. If we're going to depend on CNAs to take care of our aging loved ones, we have to make sure they're getting the support and respect they deserve.
I couldn't agree more. And that's where understanding comes in. The more we know about what CNAs do, the better we can fight for them, whether that's supporting policies that prioritize elder care or just treating the CNAs we know with the respect and appreciation they've earned.
It's about recognizing that they're not just another part of the healthcare system. They're the human touch, the compassionate presence. That makes a world of difference for patients and their families.
Here's a little thought experiment for you. Imagine that you or someone you love needed long-term care. Wouldn't you want someone who's not just skilled at their job, but also kind and compassionate? Someone who sees you as a person, not just another patient.
Definitely. And that's what this whole curriculum is trying to do, to foster those qualities in the next generation of CNAs. It's about making sure that the care we receive, whether it's for ourselves or for our loved ones, is built on empathy, respect, and a real understanding of what it means to be human.
And that brings us back to you, the listener. Whether you're thinking about your own future care, helping a loved one, or just trying to figure out the healthcare system, this knowledge is powerful. It helps you ask the right questions, advocate for better care, and appreciate how important CNAs really are.
We've just scratched the surface here, but I hope this deep dive has made you curious to learn more. I encourage you to check out the whole curriculum. It's full of great insights. And the next time you see a CNA, remember what we've talked about. They're not just assistants. They're skilled professionals, compassionate caregivers, and a vital part of our healthcare system.
Thanks for joining us on this journey into the world of CNAs. We'll see you next time for another deep dive.